Hi, and thanks so much for joining us for this Kentucky One Health Live Q&A as we talk about an issue that a lot of us deal with at this time of year. This is seasonal allergies. I'm joined today by Dr. Jessica Lange with Kentucky One Health Ear, Nose, and Throat Care. Thank you so much for being here.
Thank you for having me.
And so the last couple of weeks we've been asking on social media for you to tune in today and ask Dr. Lange your questions about seasonal allergies. Also tweeting to the Kentucky One Health page as well your questions about seasonal allergies. You can use the hashtag KY1, the number 1, Ask a Doc. That's Kentucky One Ask a Doc. So we're going to begin today with a few questions that we had talked about in advance that we thought would be good starter questions. And the first one is, Dr. Lange, what are allergies?
So when people think of allergies, we typically think of what we call a type 1 hypersensitivity. Basically where your immune system has an overreaction or a hypersensitivity to something that otherwise would be considered benign. For example, pollens, pet dander, or even foods potentially.
When does allergy season technically begin?
That kind of depends on what part of the country you're in and what you're allergic to. In the spring, we typically think of tree allergies as they start to bloom, and as we get closer to summer, kind of those grass allergies, and then in the fall, kind of those weed allergies.
And what can cause an allergy? What causes people to do the sneezing, the coughing, everything that comes with it?
So it's kind of that hyper reaction to those pollens or the dust or dander like we talked about before. Basically, it causes your immune system to kind of attack those cells and release something called histamine, which causes those itchy eyes, runny nose, congestion, sometimes even some shortness of breath.
Are there common allergies that a lot of people tend to deal with the most?
So pollens is definitely one of them, pet dander, cat and dog. Indoor allergies include dust mites, molds, and then again, people commonly have some food allergies. And adults, they develop, fish allergies, shellfish allergies, and kids as well as adults, peanut allergies, nut allergies, as well as egg and milk.
And again, we want you to ask questions as we're talking to Dr. Lange. So if you have any seasonal allergy questions, again, join in the conversation here on this video, and also using the hashtag KY1 Ask a Doc. That's Kentucky One Ask a Doc. One question that we did get already is from Randy, who says, can you become allergic to something as you get older? Does that change?
Absolutely. You can continue to develop allergies throughout your life. So just because you weren't allergic to something previously, you can become allergic to it later on. You typically have to be exposed to something multiple times prior to developing an allergy, but definitely adults can continue to develop allergies as they get older.
And how can somebody determine this is an allergy versus I actually have a cold?
So one of the things that you look for, because their symptoms can be very similar, is kind of the duration of time. Colds are going to typically last 3 to 10 days. Seasonal allergies are going to be out there really as long as that pollen or grass is out there for you. Other things that kind of help differentiate between them, colds and allergies are both going to have that runny nose, that congestion, but colds don't typically have any itching of their throat or itching of their nose or eyes. And again, with a cold too, you may have a fever or body aches, which aren't necessarily associated with allergies.
How do most people relieve symptoms of allergies? What is required to help relieve the allergies?
There's a couple different types of medications that we usually prescribe to patients or tell them about. One of the big ones that have come out recently is nasal steroid sprays, such as Flonase or Nasacort, different ones that help kind of decongest the nose and help prevent that allergic reaction. Other common ones that people know about are antihistamines that they take orally. We have some of the older acting ones, which is Benadryl, and then some of the newer acting ones are Allegra, Claritin, Zyrtec, and those kind of help, again, reverse some of those symptoms that you're having.
Another question that had come in is from Kristen, who had asked, should I use an over-the-counter or prescription medication to treat my nasal allergies? So that kind of goes back to that, just determining which is best.
So now there's Flonase is also over the counter. A lot of the anti-allergy medications are over the counter. If you're just having brief episodes, I think it's perfectly fine to use over the counter to see if that helps. However, if you're continuing to have symptoms, I would probably see an allergist or an ENT to better determine whether or not you need more medication.
And how will the allergist and the ENT diagnose allergies? How does that process happen?
So Two of the more common methods, one is called skin testing. Basically, they either do scratch testing or prick testing, where they make a small cut into the skin and then a drop of allergens on top of that to see how the skin reacts. For some patients who aren't able to perform that, for patients who are on beta blockers or certain medications, or for children who are too young, they can do a blood test that actually looks to see if you're allergic to things as well.
And is there a certain treatment that once you've been diagnosed with allergies, they can treat you, or is there not a specific treatment to be?
So a lot of times, again, it's avoidance of things that you know you're allergic to, which is possible for some things. Obviously, you can't avoid going outside during pollen season. Again, those medications, and then another option for certain people who have significant allergies.
Basically, they either do scratch test.
We're trying to look at your questions right now.
Or
avoid going outside.
Yeah. So the other thing you can do that allergists or ENTs do is something called immunotherapy, which can either be an allergy shot where you're slowly kind of being injected with small amounts of allergens to try to build up your tolerance and actually try to somewhat cure your allergies. And another method is actually doing drops under the tongue, again, slowly increasing the amount of exposure you have to that to try to actually reverse you from having that allergy.
Okay, and again, you just heard it a second ago. We're trying to click in to see your questions. So if you have any questions for Dr. Lange about seasonal allergies, now's the perfect time to ask because we have her right here. So go ahead and just jump on and let us know your questions. And again, that hashtag, if you're joining us from Twitter, is Kentucky One Ask a Doc. So you were just talking about how they can be treated. Is there a cure though for allergies?
Again, the immunotherapy is the only thing that you can consider really curative, where you do the shots or the drops through the tongue, and sometimes that can actually cause people to no longer be allergic to things.
So I noticed growing up, my mom had really bad allergies. I also have really bad allergies myself. Can they be inherited? Is that something that can
absolutely. The ability to have allergies can definitely be inherited. Specific allergies aren't necessarily inherited, so just because your parent's allergic to one thing doesn't mean you necessarily inherit that same allergy to that specific thing, but the predisposition for having allergies can be inherited. About 1 in 5 people in the United States will have allergies.
Okay, and then what does pollen count mean? Because we hear that so much, especially when watching newscasts, you hear people say the pollen count's going to be so high today. How does that all tie back?
Basically, that's the number of particles in the air. They look at basically a square meter, and then they determine how many pollens are out there to kind of determine that.
And then what would your best advice be for somebody that may be suffering from spring allergies, especially since we're heading into spring now and they're starting to deal with the sniffling, the sneezes, the coughing? What would your best advice be for them?
Definitely over-the-counter antihistamines, as well as those nasal steroids, are a good first treatment, as well as avoidance if possible. But again, if this is a persistent problem or not improving with those, definitely seeing an ENT or an allergist.
And we have another question that just came in from David. Is there a preferred age to get tested for allergies? Should you do it at a young age? Should you do it at an older age?
Typically for seasonal allergies, they recommend kids at least be over the age of 2, just because you have to have a certain number of exposures prior to developing that allergy. So testing kids prior to that for at least outdoor allergies isn't necessarily going to be as accurate until they get to be over that age. Now, indoor allergies and food allergies are a little bit different, but for seasonal allergies, usually at least over the age of 2.
Okay, and then another question from Jason. How do you determine when you need something more than the over-the-counter medicine?
I think, if you're continuing to have symptoms after using them for a few days, it would be a good reason to go ahead and try to make an appointment with someone.
Okay. Is there any other questions you think we're missing out here that people should be aware of, especially as we're heading into allergy season?
No, I think that's a pretty good group of questions. Any other questions out there from you all?
Yeah, we'll keep it open for another few minutes to see if there are a couple more questions. We're just scrolling through right now to see if anybody else has a question regarding spring allergies. And a big thing too, you were talking before this started about, we have spring allergies, you have summer allergies, you have fall allergies, and I didn't realize that there's, for each season there's a different allergy, because I think I'm affected by
Absolutely.
each season.
So spring allergies are typically more to trees. As we get closer into the summer, you start having those grasses come out that people have allergies to, and in the fall it usually switches more to weed. And again, people can have year-round allergies, especially to indoor allergens such as the dust mites, molds, etc. So definitely possible to have allergies year-round as well.
Yeah, I think the weeds are something that I'm probably the most allergic to. Another question that's coming in: as an ENT working with a patient who already has issues, how should I work with my primary care physician?
They're definitely a great first person to go see. A lot of times, again, they can prescribe the nasal steroids or antihistamines and help you determine whether or not they think you need further treatment.
And this is a really good question. I know a lot of people here in the state ask this question quite a bit. Why is Kentucky so bad for allergies?
Part of that's just that we are in the Ohio River Valley, meaning kind of those pollens and stuff kind of get trapped in the air, which is why, and again, we're a warm environment, so we have lots of blooming too. So those are kind of those two reasons why we have a little bit more allergies here.
Do you yourself suffer from
Absolutely.
allergies? And
Absolutely.
you lived away from Kentucky for a while and then came back. So did you see the difference when you moved away
Well,
and then came back?
I moved actually to a place that again has lots of allergens, so
Okay.
I didn't really notice the difference that much. But people definitely do notice a difference sometimes when they move away to places that don't have necessarily that same pollen count or kind of trapping that we have.
I notice it a lot on vacation. When you go on vacation, you may go to a place where all of a sudden you feel like, I don't have any allergies at all. And then you come back because, again, as you said, we're in that Ohio Valley region, and all of a sudden the sniffling and the sneezing, it all begins as soon as you get back.
Absolutely. And part of that too on vacation is, again, like we talked about before, you have to be exposed to something so many times before you necessarily develop an allergy to it. So on a vacation, you definitely may not have those allergies. Now if you live there long term, you may develop allergies to that area.
Yeah. And then how long have you lived here in Kentucky as well, suffering from allergies?
I've been living here my entire life, other than when I moved away from residency.
Yeah. So when I was young, another thing that I would do, and I know you talked about the testing, I remember at a young age going to get tested where they would prick me to see what exactly it was that I was allergic to. But some of the things they told me at a young age, for instance, they told me at a young age I was allergic to milk and ragweed, but as an adult, I'm fine with milk. So can it change?
Yeah, absolutely. Food allergies are one of those things that people can outgrow, and a lot of times kids do outgrow milk allergies.
Yeah, so I guess when they tested a variety because I had the ragweed in there, so I think I'm still allergic to that one. And then what about filters on air conditioners? Do those help at all? Hurt
Absolutely, they do help.
Okay.
And for people who have allergies, especially to those seasonal allergies, that can definitely help with those and kind of controlling the amount that gets into your house.
Okay. Well, I think that's all the questions we have for you, and thank you to those that joined in and asked questions both on Twitter and on Facebook. And a big thank you to Dr. Jessica Lange with Kentucky One Health Ear, Nose, and Throat Care for being here. And if you all continue to have questions about allergies, or maybe you find yourself sniffling, sneezing, you need to talk to somebody, we do have primary care providers that can help out with that. Just visit KentuckyOneHealth.org/find primary care. Again, KentuckyOneHealth.org/find primary care. Thank you so much for joining, and have a wonderful rest of the day.